every day on television there are advertisements for clear aligners to straighten teeth. Some a dental professional is involved, and some you do it all at home and send it in for someone to make clear aligners, and then your teeth will be straightened. The clear aligners are a great technological advancement in orthodontics. However, they're effective for mild to moderate crowding or spacing, and that's about 25% of people that need orthodontic treatment, which means that you can end up achieving the goals of a better smile and a healthy bite that's stable in about 25% of patients if the aligners are totally successful. The parts that are missing that concern me are different categories of orthodontic problems. Yes, you can straighten upper and lower front teeth to a point, close spaces, and reduce crowding with clear aligners, but they have limitations when it comes to resulting in functional bites of the side and front teeth, reducing overbites, and resulting in a stable functional bite that is long lasting. And unfortunately, there's no one to tell you this right after those commercials. There's no public service announcement by a board certified expert in orthodontics like myself. I have 35 years of orthodontic experience, and orthodontic problems fit into different categories. The teeth are attached to jaws, which are bones of your body, and if the inheritance or the development of the bones of your body don't match up, your teeth are not going to match up, and if your teeth don't match up, you could have a bad bite, you could have a cross bite, you could have an overbite, you could have an underbite, and over time your teeth can wear down, you can lose bone around your teeth, and you could lose some of your teeth if you don't have a healthy bite as time goes on. So as a board certified expert, what we do is a thorough clinical evaluation of patients of all ages that come to our office. We're using the discussion about clear aligners, focusing on adults, and there's even advertisements on teen aligners for aligning the teeth for teenagers. But the first category of orthodontic problems are jawbone related, and aligners do not fix jawbone distortions, and they also are ineffective in fixing significant bite problems like overbites or traumatic bites. So you have to know what the problems are before you come up with a treatment solution. The clear aligners that are advertised are treatment solutions without getting into what the problems are, and I feel like the understanding of people's problems is the most critical part of having a successful treatment plan. So you need to have a thorough evaluation by a board certified expert in orthodontics, someone who has training in knowing what the problems are in order to then come up with possible treatment solutions. So in all of our patients, they end up with beautiful smiles, but we also make sure that they have healthy bites and they have stable results. And it may be that the problems they have don't fit into the effectiveness of clear aligners, and going to someone who can tell you what the problems are, what the treatment goals should be, healthy smile, a stable bite, are super critical to then determine what is the best course of treatment. It may be that clear aligners are going to be successful, or it might be that aligners will take you 25% of the way. Being frustrated using clear aligners as a board certified orthodontist, I created or invented a system called Beats Braces. Beats Braces stands for Bronski Orthodontic Aesthetic Adult Treatment System, and Beats Braces is a technique where there are multiple methods to achieve a goal. Some patients have clear aligners that are followed by aesthetic orthodontic brackets and wires to finalize the movements of the teeth, both the part you can see, the crown of the teeth, and the roots, in order to get the stable bite and finalize the ideal smile that you want. So the system that I have allows you to treat adult and teen orthodontic problems, but it doesn't just focus on aligning the upper and lower front teeth and ending there. And it's a very, very effective treatment. And I came up with it because I was so frustrated by people saying, I'd like to have clear aligners on my teeth. And I'd say, well, let's do a thorough evaluation. And then once we had our evaluation completed, measurements, photographs, x-rays, I would review everything and consult with them. And at the consultation, I'd go over with the problems, and most of them would say, oh, I never knew I had problems that were that severe. I can see now where clear aligners would probably take care of the problem I was concerned with, but it wouldn't help with the bite that I have, and I'm worried that I might lose my teeth because of the bad bite. Why don't we use your Beats Braces system and start with clear aligners or aesthetic porcelain orthodontic brackets that are efficient in giving me the smile I want and the bite that I need. And once I discuss what people's problems are, they're always wanting to have the best smile and the best bite in the most stable result, and they're thrilled with my Beats Braces system. And I have a story about someone who I saw today, and it's a great story. I have two cards here from the same person. She lives about an hour away, and she saw me 12 years ago and came into my office and said, I don't like the way that my teeth look. My bite's uncomfortable. My dentist said that I'm losing bone around my teeth because of my traumatic bite. I can never keep my teeth clean. And you proposed a treatment, and then I moved out of town, and I never went ahead with it. And then 2 years ago, I went to an orthodontist in another city and said, oh yeah, we could use clear aligners and we could improve the alignment of your teeth, but we probably can't fix all of the rotations or fix your bite because the problem is too severe. Well, they didn't really have my system of Beats Braces. So this woman's husband said, that doesn't sound good for me. It's like, we want to make sure you have a stable result, that all of our goals are met, and you have the best bite. Why don't we just drive down to meet with Dr. Bronski, and we know how thorough he was. Let's find out what you really need. So she came in, we did a thorough evaluation, clinical measurements, photographs, some molds and x-rays, and then she came back with her husband, and we had a meeting, and we went over the orthodontic problems that she had. I explained to her that her tooth rotations and bite were past the scope of using clear aligners, so she agreed to using our Beats Braces system, and she is thrilled with the result. Her teeth are able to be cleaned easily. Her bite feels comfortable. Her dentist said that her bone and gum health have improved significantly since she had her teeth lined up, and she continues to call and send me cards just because she can't believe she waited 12 years to do something that could have happened a long time ago. And it's, to her, it almost seems like a dream come true. And that's what she said to me today. She said, I can't believe I waited that long and I couldn't be any happier. Thanks very much. And that's why I wanted you to see these cards, because she just keeps sending them. Every time she looks in her mouth, she's like, she just can't believe it. And she said, thank you for using your Beats Braces system to give me a beautiful smile and a healthy bite. And I'm looking forward to having the teeth the rest of my life. And I couldn't be any happier.